هاي تكون أول محاضراتي راح أبلش معاكم هالسنة. إن شاء الله راح أعطيكم محاضرتين هالأسبوع والأسبوع الجاي إذا الله تعالى طعاكم صحة وعافية وعمر. راح نبلش باقي المحاضرة شوية خفيف الدم عن الاسترلايزيشن وديسانفكشن. المحاضرة اللي بعدها شوية راح تكون ثقيلة عن الميتابوليك ريسبونس تو انجري، فقررت أبلش معاكم بهذه خفيفة وسهلة بس بيها شوية كم كلمة تحفظوها. يعني بيرن، هذا ما البيرن، sterilization disinfection حسن. فراح نبلش بالديسانفكشن. الصوت واضح؟ قولوا لي لو اكو مشكلة بالصوت.
لا واضح صوت.
حلو. راح نبلش بالتعريف مال disinfection. عشت ايدك. Disinfection is a process that kills or remove pathogenic microorganisms except spores. يعني يفضل انه تفتهموها، تحفظون بعض الشغلات. ممكن تجيكم مقارنة بين الاسترلايزيشن والديسانفكشن. من التعريف الديسانفكشن هي اقل درجة من الاسترلايزيشن. ديسانفكشن هي راح تقتل البكتيريا والميكروبات باستثناء السبورز. واضح التعريف. Disinfectant is a chemical agent used to achieve disinfection. How we can best get the best efficiency of disinfection? This will depend on 3 points. First, the nature and load of microorganism. Second, the duration of temperature of the environment. هذا الحكي راح ترجعونه هسه بالميثود اوف ديسانفكشن. تعرفون ايش معناها هذول الثلاث نقاط اللي هي يعتمد عليها فعالية الديسانفكتنت. فإذا قلنا what is the methods of disinfection، ممكن نستخدم اللو temperature stream اللي هو عبارة عن dry stream at 73 degree centigrade for 20 minutes at sub-atmospheric pressure. Or we can use a boiling water which reach the temperature of 100 degrees centigrade for 5 minutes at normal pressure. So as you see, we manipulate the degree of the temperature, the duration, and the pressure. These will affect on the efficiency of the disinfectant. The third way of, or the third method of disinfection, we can use formaldehyde gas exposure in a specialized cabinet at 50 degrees centigrade. Or fourth, we can use glutaraldehyde 2%, which is effective for heat sensitive materials. Sometimes we have some heat sensitive materials like flexible endoscopes. We can't expose them to boiling water or formaldehyde or temperature, so we use this chemical material. But the side effect of this, it is toxic and may cause allergic reaction. This was disinfection. Regarding sterilization, as you may expect from the definition of disinfection, it is a process that destroys all forms of microorganism or microbial life, including bacteria, viruses, fungus, and spores. So sterilization will destroy all forms of microorganism. Methods of sterilization, we may use an autoclave. This is not the usual autoclave. This is a specialized autoclave container, supply moist stream under pressure with high temperature. used for metalware, glassware, rubber, and dry goods. The temperature and time needed are 3 minutes at 132 degrees centigrade, or if the temperature is decreased, we should increase the time, or 8 minutes at 125 degrees centigrade, or 15 minutes at 118 degrees centigrade. This is, as you see in the picture, a specialized autoclave, not the usual kitchen autoclave. We may use ethylene oxide, which is a penetrative, not corrosive gas used to sterilize heat and moist-sensitive substances. Or we may use gamma ray irradiation to sterilize syringes, catheters, cannulas, and other plastic tubes and heat-sensitive subjects. These used in the factory, these material, before sealing them, they sterilize them with gamma ray. Or we may use peracetic acid, which is a chemical agent, cause protein degeneration, suitable for endoscopes. Regarding skin preparation and wound cleaning, we may use different types of sterilizing material. The first and most common is bovidine iodine. Can be used to disinfect skin before operation and to clean infected wounds and ulcers. The side effect, it may cause allergy to some people. It may cause metabolic acidosis. It may interfere with thyroid function test. Not recommended in a pregnancy. Not used inside abdominal cavities. As I said, it is used to disinfect the skin before operation and dirty wounds or ulcers. In later on dressings of the wounds, it's preferable not to use bovidine iodine because it will kill the granulation tissue. So we start with bovidine iodine when you receive a patient in the trauma room after trauma with multiple wounds. You can use bovidine iodine with jet of water, of distilled water, to clean the wound. Then later on, when you do the next dressing, it's preferred to use the bovidine iodine only on the normal skin around the ulcer, while inside the ulcer or inside the wound, it's preferable to use normal saline to wash the wound. Why? Because bovidine iodine will be toxic or will kill the granulation tissue that will form when the healing process will start. Another material which is used for skin preparation is chlorhexidine, which is effective against gram-positive microorganism and can be used to disinfect the skin before operation and to clean infected wounds and ulcers. We may also use alcohol 70%, also used to prepare skin for operation, not used for wounds or ulcers. Or lastly, which is used for much less extent, is hydrogen peroxide, which is a weak disinfectant. It forms a lot of gas. This gas will help to flush out debris from cavities by mechanical action. So also, when you receive a dirty wound, you can use this hydrogen peroxide, although its use is much less decreasing over the time, because it is discovered to be a weak disinfectant, but can be helpful to flush out debris or foreign bodies or bacteria from cavities and wounds. These points, these coming points, are important. How you prevent wound infection. As you know, prevention is better and less costly than treatment. So our aim as a surgeon or even a doctor in any department is to avoid or to prevent wound infection. better than getting wound infection and try our best to treat it. This prevention is carried out on many levels. We will start at patient level. These very important points you should always remember and know, because you will need them when you handle the patient in any department in your medical practice. So, how we can prevent wound infection? One, at patient level, we avoid prolonged preoperative hospital stay. Why is that? Because we try to avoid nosocomial infection. Sometimes you admit the patient to the ward. Unfortunately, our wards are general surgical wards, so he may have a simple hernia repair. The admission is near a patient with multiple microorganisms in the wounds. The next patient may have pneumonia. So the best is to avoid prolonged preoperative hospital stay. Second, you should try to control any source of infection as possible. Control any medical condition that decrease immunity, as diabetes mellitus, uremia, anemia, malnutrition, electrolyte disturbance. Preoperative bathing. Stop smoking. Avoid shaving the area. If this is mandatory, it should be on the table. So, either on the table or immediately before operation. It is better to shave the area. If you suspect that you will have a source of infection, or you may open a hollow viscous during your operation, you can use a prophylactic antibiotic, and of course, early post-operative mobilization, exercise, and discharge from hospital. These points was aware how to prevent infection at patient level. The other level we should work at is at the staff level. Staff with focus of infection should not deal with patients. If you have a nurse or a doctor or an anesthetist with chest infection, with the source of infection, you should give him a sick leave, do not or give him a job away from the patients. The second point is very important. Decrease the number of staff in the operative theater with less movement as possible. يعني هسه انتم غدا بعد غدا تروحون تفوتون تطمشون على العمليات، تريدون تحضرون عمليات. You will see that the operative theater is open, everyone can enter, everyone can leave, everyone can come and get or say something. In a respective operative theater, this should not be happened. Number of people who enter the theater during operation should be very limited. Even the staff. يعني أنا كنت اشتغلت بمكانات هم بس ممرضين، واحد يساعدك بالعملية والآخر يسمونه سيركوليت، يجيب له ايش يحتاجه فقط. وإذا اكو طلاب يريدون يحضرون المحاضرة، المفروض اكو فيديو، اكو قاعة يم صالة العمليات يطمشون على العملية ليف بس من خارج الصالة. اللي راح تشوفونه عندنا انه الباب مفتوح، واللي يفوت يفوت واللي يطلع يطلع، وبالتالي نتعجب ليش المريض صار عنده ووند انفكشن. بالعمليات المحترمه ممنوع الدخول، الجراح بس يطيق يدخل والمساعد مالته وعدد محدود جدا من الناس. فهذه طبعا راح تاثر على الووند انفكشن، راح تقلل من نسبه الووند انفكشن. فديكريز number of staff in the operative theater with less movement as possible. Wearing special clothes and gowns. Using head caps, face mask and boots. Hand washing. wearing sterile gloves during surgical procedure and usual gloves when dealing with infected focus. تعرفون عندنا نوعين من الكفوف، اكو السيرجيكال جلوفز هاي اللي تفتحوها من كيس معقم، هذه نستخدمها عاده بالعمليات الجراحيه، يعني حتى اذا كانت ماينر عمليه بالعياده او ماينر سيرجري عند اللوكال انستيزيا نستخدمها الستيرويد جلوفز. اما اذا انت جاي تفحص انفكتد ووند او جاي تبدل درين او جاي تعمل دريسنج، يعني عاده نستخدم هاي الكفوف العاديه اللي تجي كل 100 بكيس، هاي يسموها نون ستيرال جلوفز او اليوجوال جلوفز. هذه كانت at staff level. At operative theater level, the operative theater design and building، هاي ما بيدنا، هاي المفروض من التأسيس يكون الاوبراتيف ثياتر يكون مصمم حتى يقلل الانفكشن قدر الامكان. اكيد الفنتليشن سيستم مهم جدا، وهم مثل ما قلنا هاي شغلات تدخل لازم بالتصميم. وهاي معمول بيها بالدول انه قبل ما يجي يصمم المستشفى او يصمم صالة العمليات لازم يعتمد بيها على افضل التقنيات من فنتليشن ومن تعقيم ومن عزل. حتى مكان اختيار المستشفى، ما اي مكان يصلح انه يكون مكان للمستشفى تنبني به. اكيد the table and the light source is important. Anesthetic machines and equipment are important. Suckers and electrocauterization devices are important and should be take care of their sterilization and disinfection. Surgical instrument is very important and should be sterilized very properly. Lastly, number 4, how you prevent wound infection at surgical ward and medical devices level. Surgical ward devices, which include beds, mattresses, pillows, urinals هاي يعني بالعربي المبولي، المريض اللي ما تقبل اكو حافظه حديد يجيبوا له هي يبول بها هو بالمنام، فهذول كلهم لازم انت تحافظ، يعني كلها تكون سورس اوف انفكشن، لازم كلها دائما تعقمها وتنظفها. البيدز لازم المطيغح الشريشف كلها تكون معقمه للمريض، تتبدل من مريض لمريض، هاي معظمها يعني مع الاسف عندنا ما مضبوطه. المخدات تكون سورس اوف انفكشن لازم كلها تتعقم، هسه بالخارج كلها يستخدمون ديسبوزبل، كل مريض يدخل ينفغش له سيت مالته جديد. واكيد السيرجيكال ترولي اللي راح تجيب بيها الغراض والتعقيم وتعقم الوونز وتبدل الدرينات لازم كلها تكون نظيفه ومعقمه. Reception and examination rooms should be proper equipped and prepared. Cannulas, IV sets, drains, tubes, blood transfusion sets, all should be properly sterilized and kept. And lastly, the visitors، اللي هذه نقطة جدا مهمة، احنا يجون قبائل يزورون المريض وما تعرف، خاصة هسه في زمن الكورونا ما تعرف منه بيهم المكورن، ما تعرف منه بيهم اللي عنده infectious disease، ما تعرف منه اللي بيهم عنده chest problem. المعز يتبين بالمستشفى ويجون. يعني احنا من نقول قللوا الزيارات قدر الامكان، ما لانه احنا نضوج من المرافقين، بس لانه المشاكل الصحيه اللي ممكن يعملوها المرافقين للمريض وللمرضى اللي حواليه. اتصور محاضره خفيفه وبسيطه، اذا عندكم اي سؤال انا جاهز للسؤال، اذا ما عندكم شيء خلصت المحاضره وممكن تفضلوا. ماكو سؤال؟ بس اكو واحد من الحضور يخلب ايدج، هذا ايدج شلون راح نسجله غياب؟